Well, if you're like me, sometimes, especially right now, you need a break from the politics, and you just want them to give it to you straight, right? And that's what I was thinking about the Affordable Care Act. Now, we've heard it used as a political football a lot. We would just like to know, if you're like me, is this thing working or not? And some of the stories, of course, that were in the news in the last week had to do with premiums increasing. There were stories previously about insurance companies withdrawing from the exchange. And at first brush, that seems to suggest that there are problems with this, but we need a big picture. And then sometimes when you try to get that, you get the political noise with it. So we went looking for someone who could help shed some light on this, and we came across Vivian Valdmanis. Vivian is in the School of Interdisciplinary Health Sciences program in public health at Western Michigan University. She's had more than a 30-year career teaching in places like, or at least involved in research in places like the University of Arkansas, Oklahoma, Tulane, Vanderbilt, U of M. She's a specialist in teaching healthcare economics, a published researcher. She reviews books and technical reports and participates in reviewing more than 20 journals. And so she seemed like the right person to talk to about this. Good morning, Vivian.
Good morning.
If I went on any longer, we wouldn't have time for the interview. Impressive career you have.
Thank you.
So the Affordable Care Act, as I'm saying, is something that gets caught up in a lot of political noise. But I guess the big question is, from your perspective as a medical researcher, is this thing doing what it's supposed to be doing?
Well, in some respects, it is doing what it's supposed to be doing. It's got a lot of good qualities to it. The keeping kids until they're 26 on your insurance, getting rid of preconditions that have kept a lot of people out of health care. But on the other hand, it's not doing what it's supposed to be doing. There's still a lot of bankruptcies due to medical costs, even with the, insurance. And it's not providing the kind of universal coverage that it was supposed to do.
Why isn't it?
Well, a lot of the big problem is you can't really expect the for-profit firms, these for-profit insurance companies, to do social welfare programs. They're in to make money, and that's what they're supposed to do. And if they don't have healthy young people signing up, then they have to raise the premiums because all they're insuring are people who are using their services, and that costs them money.
And that's what we're seeing now?
Yes.
Do you see that changing?
There's some speculation that there could be the public option where people can buy into Medicare. That might, do more good in that you already have a system in place. Now, for full disclosure, I've always been an advocate for universal coverage through a Medicare program for all, because then you get the healthy people as well as the less healthy people, and then you have an insurance plan that would be based on the population medium.
Mm-hmm. And that is the way insurance works. Some people pay for it and don't use it. Other people are using it.
That's right. But if you have everybody in the same system, then you have the actuarially fair mean price that would be paid probably, via taxes.
Mm-hmm. Right. Well, let's talk about what we see in addition to this right now. You talked about how more people are covered and some people are covered longer, like young people and so on. As you look at those statistics, do we see benefits of that in terms of people being healthier?
Again, that's very hard to say because, we're not a very healthy society. The U.S. ranks very low compared to other industrialized nations in terms of health outcomes. And, but on the other side, there is the good things that people are going and getting preventive care more now that they're insured. So, and I know with my insurance, I get a preventive care visit for $0 out of pocket once a year. So, I mean, in the past, when people would have to pay $100 or $200 to see a doctor, then they wouldn't go. But now there's more prevention and more care given. But again, it's very difficult to see if people aren't used to having preventive care visits.
It is interesting because the insurance model for, say, middle-income people hasn't changed much, has it? Even with this kind of a situation. Some people still have significant deductibles they don't meet over the course of a year, or if they do, they start over again soon after that. And the premiums are somewhat high, and those folks aren't necessarily part of this this whole Affordable Care Act system. Do you see that changing?
Only if they change the model. I really don't see economically how you can have, people who are middle income who aren't insured through their jobs getting any kind of break. And that's sort of the hard thing to see in this case. There are many, many more people who are insured because of the Affordable Care Act, which is good. But again, like I said earlier, there's still the cases where there aren't people who are insured, and they still use the most expensive sources for health care, such as the emergency room.
We're talking with Vivian Valdmanis. She is with Western Michigan University's Department of Interdisciplinary Health Programs. We're talking about the Affordable Care Act. We'll take a short break, come back, talk about weather, and continue with our discussion this half hour on WBCK. We're talking this half hour with Vivian Valdmanis. She's with the WMU Department of Interdisciplinary Health Programs, has had a career in health research and instruction, and so we're talking about the Affordable Care Act. Vivian, you made the point that for-profit insurance companies have trouble with social welfare programs. In Michigan, the Affordable Care Act insurers primarily are not profit, right?
That's right. It's primarily through Priority Health and Blue Cross Blue Shield. And also Michigan has expanded Medicaid to for the less fortunate. So in this state, we're pretty well covered and probably don't have the same problems as states such as Arizona, which has seen the highest increase.
What has been the climate there with this?
Well, they have a reported increase of 113% in their premiums, but also the demographics in Arizona are quite different. But they traditionally had lower premiums. So the premium question needs to be taken with a grain of salt because you needed to see what the premiums were before. Now, a lot of people have said that the insurance companies underpriced to get into the competitive bidding.
I see.
So they were cheaper to start with, and now they're becoming more expensive to cover their actual costs. But it's not it's not to say that it's becoming outrageously expensive. It just depends on the base point.
So when you look at these snags, and then you look at the whole picture, is this a flawed model or one that just needs tweaking?
It needs tweaking.
Are we going to get that, do you think?
It depends who wins the election, and I didn't want to bring politics into it.
Yeah, right, but I guess it does depend. So, and because, speaking of that, for example, Donald Trump has said the whole thing needs to be replaced. Is there another model out there that corrects these problems and vastly improves this?
Well, yeah, there is, but I don't think politically it would work in the U.S. There's the British system, which is the National Health Service, which I've had personal experience with, and I had great care when I was in London. and there's other European models where everyone is covered, but everyone has to pay into the system. The problem with the U.S. system is there's mandates, but if you don't sign up, the penalty is pretty inexpensive.
Mm-hmm.
So unless they tweak the system so that more people sign up into the insurance and you get healthier, younger people in the system, along with the less healthy people, there's still going to be these kinds of problems where you do have higher premiums that keep going up.
Is there a way then to tweak that? I think you alluded to it, but is there a way to tweak that, for example, if Hillary Clinton is president, we presume then that those discussions would take place?
Probably, and what you would need to do is make the penalty equal to what the insurance payment would be.
I see. So then you don't have a choice.
Yeah. So they would buy the insurance. I mean, when you set it too low, there are people who are healthy and they figure, why should I buy insurance? I'll just pay $500 penalty.
Mm-hmm. Interesting. How about the medical model in general, as you've studied this and obviously been around the world and compared it to others? I talk with some folks who say, just take a look at this. All they want to do is get you under a knife or get you on a prescription, and that's the way this works.
Yeah, that's pretty much it. I mean, where you make money is by having procedures done. And it isn't a health system, it's a medical system in this country. And the way the insurance has always been set up is that it would reimburse for procedures and not for preventive measures. Mm-hmm. But that's starting to change more now.
How so?
I think you're seeing a lot more people who are taking responsibility. And what's interesting is you see, for example, no smoking, where you can't smoke inside in restaurants or bars anymore in this country. Mm-hmm. So that's a step in the right direction. You also see more, with Mrs. Obama's Get Up and Move, more, getting kids moving and away from obesity. But I think, that gets into another situation. I remember, elementary school, we all had recess, but now everyone's too busy taking standardized tests. So, it needs to be broad and just out, beyond the medical system to get, people to do healthier things.
Mm-hmm. Does the model then have to focus more on rewards for people who do participate in preventive care?
Well, there are those systems that are in place. If you sign up for exercise classes, there's breaks in the insurance premiums. So those systems are in place. They just need to be more broad. They need to be more broadly implemented.
Well, it'll be interesting to see how this all shakes out, and we appreciate the time you've given us to try and think about it.
Okay, great. Thank you very much.
Thank you. Vivian Valdmanis is with the Western Michigan University Department of Interdisciplinary Health Programs, as we've discussed the Affordable Care Act.